World Health Organization has acknowledged evidence emerging of the airborne spread of the novel coronavirus after a group of scientists urged the global body to update its guidance on how the respiratory disease passes between people. The WHO has previously said the virus spreads primarily through small droplets expelled from the nose and mouth of an infected person that quickly sink to the ground. In an open letter to the Geneva-based agency published on Monday in the Clinical Infectious Disease Journal, 239 scientists in 32 countries outlined evidence that they say shows floating virus particles can infect people who breathe them in. Because the smaller exhaled particles can linger in the air, the scientists are urging WHO to update its guidance. Benedetta Alengrazzi, the WHO's technical lead for infection prevention and control, said there was evidence emerging of airborne transmission of the coronavirus, but that it was not definitive. The possibility of airborne transmission in public settings, especially in specific conditions, crowded, closed, poorly ventilated settings that have been described, cannot be ruled out, she said. Any change in the WHO's assessment of risk of transmission could affect its current advice on keeping 1 meter of physical distancing. Governments, which rely on the agency for guidance policy, may also have to adjust public health measures aimed at curbing the spread of the virus. Maria Van Kerkhove, technical lead on the COVID-19 pandemic at the WHO, said, "A comprehensive package of interventions is required to be able to stop transmission. This includes not only physical distancing, it includes the use of masks where appropriate in certain settings, specifically where you can't do physical distancing and especially for healthcare workers," she said. With over 13,000 COVID-19 positive cases in the state, Assam's fight against the virus gets more challenging as 5 more COVID-19 patients have succumbed to the coronavirus today. Assam's Health Minister Himanta Biswa Sarma stated in a tweet that Safikul Rahman of Hediyatpur in Guwahati, Ramani Majumdar of Palatkuchi in Barpeta, Utpal Kumar Chaliha of Kahilipara, Hari Prasad Mandal of Lal Ganesh, Guwahati had died due to COVID-19 at Guwahati Medical College and Hospital between 2 a.m. and 5 a.m. Meanwhile, a 30-year-old COVID-19 patient reportedly died at Tezpur Medical College and Hospital. With these 5 deaths, the total COVID-19 toll in the state has gone up to 21. Tripura will start phase-wise door-to-door rapid COVID-19 antigen testing across the state from Monday. The announcement comes a day after the Assam government adopted a similar strategy in view of rising coronavirus cases. In Tripura, the exercise will be conducted in 2 phases. In Phase 1, all state entry points and the population in its 28 containment zones will be covered. There are 7,629 people living in these areas. Over the next week, starting July 13, the state government will start COVID-19 antigen test for all passengers coming from Agartala Airport, railway station and Churaibari check gate on the Assam-Tripura border in North Tripura district. Healthcare workers will go to every house and screen all members. Those who have fever and display other symptoms will be tested for coronavirus. The test will be done through rapid antigen detection kit. An antigen test offers results in under 30 minutes but is less accurate than the conventional RT-PCR test. Office of the Commissioner Nagaland in Kohima has been sealed for 48 hours as per standard operating procedures from Tuesday following detection of COVID-19 positive case at Duck Lane Colony, Kohima Municipal Ward 7, and the person happens to work at the Commissioner Office's canteen. Following this, Kohima District Task Force held an emergency meeting and activated the relevant line departments as per the incident response system, wherein the containment zone had been mapped and necessary cordoning of the area and locality in the proximity of the epicenter had been made. This was stated by Kohima Deputy Commissioner and District Task Force Chairman Gregory Thejawile. Meanwhile, following detection of a COVID-19 positive case of a resident at KZK Colony in Kohima, lightning closure of all shops and commercial activities was imposed today, with restriction on movement of people within the colony as containment measures and contact tracing had to be followed. The COVID-19 positive person is an employee of Kohima Municipal Council. With increasing number of COVID-19 positive cases all across the nation, the COVID-19 status of the northeastern states are: Arunachal's tally stands at 276 positive, 169 active, 105 recovered and 2 deaths. Assam's tally has risen to 13,337 positive cases, 4,983 active cases, 8,330 recovered and 21 deaths. Meghalaya's tally stands at 98 positive, 53 active, 43 recovered and 2 deaths. Manipur's tally has risen to 1,430 positive, 659 active, 771 recovered. Mizoram's tally stands at 198 positive, 59 active, 139 recovered. Nagaland's tally rose to 656 positive, 353 active, 303 who have recovered. Tripura's tally rose to 1,716 positive cases, 454 active, 1,248 recovered and 1 death. Sikkim's tally stands at 127 positive, 34 active and 80 recovered. Total number of COVID-19 cases in the Northeast stands at 17,838 positive cases, 6,764 active cases, 11,019 who have recovered, and 26 deaths as of July the 8th, 2020. From all of us here at NE8, stay strong and stay safe.